Salam everyone. I'm Tanzila Mukhtar and I work for Kashmir Care Foundation. I extend a warm welcome to each one of you to this very special edition of the Spotlight series, a platform where we celebrate the spirit of excellence, resilience, and leadership that shines across the Kashmiri connection. These sessions are meant not only to inform you, but to inspire and remind us all that what is possible when determination meets purpose. Today, it's our special honor to spotlight an individual whose life and work embody those very values. We are privileged to host a figure of great distinction and deep humility, a pioneering Kashmiri neurologist who has risen to one of the most respectable leadership positions in his field. From his early days in the beautiful yet challenging Kashmiri landscape to his current role as a chair of the Department of Neurology at the University of Toledo, Ohio, Dr. Noor Pirzada has charted a remarkable path. His journey is not just about the professional milestones, but it's a continued story of vision, service, and a lifelong commitment to advancing medicine and mentoring the next generation. Dr. Saab's achievements speak volumes. He's going to tell us more about that while we continue our conversation. But what's most important is his continued connection to community, his willingness to guide youngsters, and his leadership that makes this session equally important for all of us today. So please join me in extending a heartfelt welcome to Dr. Saab, Dr. Noor Pirzada. Thank you so much for joining us today. It's a privilege to have you here. Thank you.
Well, thank you, Tanzila. Thank you for that introduction, and thank you for having me on your program. It's both a pleasure and an honor, and I'm really grateful for the opportunity to tell my story, and hopefully I'll be able to offer something of value to your audience.
Definitely. Okay, you're being too humble. But then, yeah, I mean, I'm looking forward to our conversation. So let's start from the very beginning, actually, from your roots in Kashmir. Tell us a little bit more about your early life. What was it growing up? What were the defining moments, influences that actually charted this path towards medicine and especially neurology?
So let me go back to my childhood since you asked. I really do have very fond memories of my childhood in Kashmir. And I think education is important. So I'm going to start, my early education was at Burnhall High School. I guess you're familiar with that, having been educated in Kashmir yourself. And I really cherish those days. I think compared to the intense and often stressful environment that I now see in schools, particularly in India, I look back and our school life was, I think, was much more relaxed. I mean, education was there, but it was balanced. We had a large, a range of extracurricular activities, cricket, athletics. I was a member of the Boy Scouts organization, and this all added variety to my school experience. And I think, when we had summer vacations, we went to places like Gulmarg and Pahalgam, and, which were not as crowded as they are nowadays. And again, those days I recall with a lot of affection. During the winter, because of my dad's, job, we went with the Darbar move to Jammu, which gave us a chance to escape the cold winter. But it also exposed us to a new place and I think a new culture as well, because, Jammu, as you know, is quite different from Kashmir. Talking about what influenced my early life, mine and my siblings' life, I think the greatest influence, as for most people, were our parents. My dad was an engineer and he earned his degree from Columbia University in the late 1940s, which I think was a remarkable achievement, for that era. My mother was homeschooled, but was also very committed to the children getting a really good education. And they instilled in us a really strong value for learning. And one thing was that although our parents, kind of instilled in us the importance of learning, but they gave us the freedom to make our own choices when it came to choosing our careers. We were not kind of forced into anything. So they were very supportive, but didn't force their opinions on us. And I think this balance played a really key role in shaping our paths in the future. So, everyone asks you, why did you go into medicine? And when I, look back on that, I think I was always fascinated by the aura that surrounded physicians. In those times, if you may not know this, but in those times, house calls were quite common, and physicians, doctors often came to your house. And when the doctor came to your house, it was like as if someone godlike had come, and everyone would like watch their interactions with awe and attention. Uh, it included the family members, children, sometimes even the neighbors, and they hung on to every word that the physician said. And so, and then when the doctor handed you the prescription, it was like, this is going to cure everything, no questions asked. And it was this, sense of reverence and this sense of trust, that I found quite fascinating and I think sparked my interest in being a physician. So that was my early life and, my how it I came to do medicine. And then how did I do neurology? Once I entered medical school, I don't know, I was just drawn to neurology because my fascination began with neuroanatomy because, it is, uh, uh, I guess I thought that it is the brain that determines what you are, your personality. It controls everything that you do. So I really spent extra time reading neuroanatomy as compared to other things. And then eventually, obviously, that led me to an interest in neurological diseases and the treatment of neurological disease. And, if I may point out here, please stop me if I need to go slower or if I need
No,
to
it's absolutely
change the
fine.
topic. Yeah,
Yeah.
so don't hesitate to stop me. But what really continues to draw me to neurology, and I want to point this out to the younger generation that's watching and listening, is that it is still one of the few disciplines in medicine where talking to the patient and getting a good history, doing a detailed examination is really important. No amount of technology is going to provide you the insight and the information that you get from that interaction. And I think it was this combination of, human contact, this combination of a connection with the patient and the intellectual rigor that really makes neurology so attractive and fulfilling for me and for many people who go into neurology. I think that we still have to have a lot of contact with the patient. And so that was the reason for me going into neurology. Now, the I guess at this point I would be remiss if I didn't tell you some of the people who actually influenced me a lot early in my career rather than my parents. One of the major, I guess, mentors and models is someone you've already interviewed on this program, Professor G.Q. Lachman. I mean, he was quite unique in those times. He had a teaching style, very all his own. It wasn't based on rote learning as it was at that time. I don't know, I can't quite define it, but he had this, method of making you think while he was asking questions. And so that made me both want to teach and to be like him. And he had two faculty members in his department, Dr. Yusuf, Dr. Muhammad Yusuf, and Dr. Asin Cole, who were very good as well. And really, I learned a lot from them. And some of the graduates from Srinagar Medical College may know Dr. Yusuf. We used to affectionately call him Yusuf Marshall because he had this very military air about him. And, and then, of course, Dr. Sushil Rasdan, I'm sure you've heard his name, whom I consider a very good friend. I mean, he was the first trained neurologist in Kashmir. And so, he and I worked together for a long time before I went for my own training to a postgraduate institute in Chandigarh. And so these are the guys, the people who I got influenced by in Kashmir. When I came to the United States, again, I have to mention a few names because I'm, deeply indebted to them. I was fortunate to work with, my initial work was with one of the best known neurologists in the US, Elliot Mangold, who was also my program director during my residency. And then when I went to Duke University for further training, Dr. Janice Massey, she continues to uh, be a profound influence on my career. She's still in practice at Duke, and Dr. Donald Sanders, and they're like world well-known authorities in neuromuscular disease and myasthenia gravis. And these are some of the people who inspired me and who helped me as I went along in my career. So
That,
that's kind of hopefully gives you an idea of my early life and why I got interested in both medicine and neurology and who are the people who helped me along the way.
that's so beautiful. So, especially like, having the correct support at the right time in your life. And then, that's so important. And we keep saying this and repeating this to all the parents as well who watch us or get in touch with us that they have to support their kids. Especially be academically oriented, it's fine, but then, at least to support in the right way and not just push them in a direction where, like, they can't do well. They have to kind of sit with their kids and try to understand what they want. And also the role of mentors, like in your
Absolutely.
life, it's really, really important. And everyone tells us this, whoever comes to the, like, everyday legends are here. So I think somewhere when I was growing up, I kind of lacked that kind of a understanding that, oh, mentorship is so important. And now during my course, I have also realized that, okay, I have so many people I am grateful to, even if, like, my high school teachers or college teachers. So it's really very important. But neurology, like I said, like I'm in the department of neurology. I'm not a neurologist. I work in the lab. And you don't have to sell it to me that how amazing neurology is. I love it. I love the brain. When I was in my PhD, my first abstract, I wrote the first line, the brain is the final frontier of science. And my
Yes.
boss saw this and he was like, take your poeticism out of this abstract. What are you writing? So I remember that. So, so I think I'm fascinated by brain as well. But like a career in neurology, especially a specialization in neurology, is rarely linear. Tell us more about the challenges you have faced while you were pursuing, say, higher education or while you were training abroad.
So, in terms of education and challenges, like I said, I've often reflected on this question, and I never viewed to repeat what I said, that I've never viewed those challenges as formidable. I got a very good schooling. I studied in an English medium school, which was a big advantage when we went for higher education. When I went to medical school, I interacted with students from remote villages who had not studied in English, and they were quite bright and brilliant and could compete with anyone. If anything, that made me aware of my own privileges that I had had. So I never thought that, in a way, I guess I made light of my challenges. I think if there was a challenge, it was later on when I had done internal medicine in Kashmir and there was a lack of advanced training. For instance, there was no neurological
Mm,
training in Kashmir. And you had to go outside, and pursuing training outside, Kashmir was not the norm. I mean, some people had done it. It's not that I was the first, but there was this somewhat of an apprehension that maybe we are not equipped to, compete on a broader national level. And so overcoming this feeling of self-doubt, I think that was one challenge. But it was something that I decided, no, if I have to, go ahead, then I need to go beyond, the landscape of Kashmir. So I applied to the Postgraduate Institute in Chandigarh, which I appeared in the open competition examination. And I was fortunate to be selected for advanced training in neurology. Let me point out at this point that my experience there was exceptional. And to this day, I believe that is some of the best training that I have received, having, been exposed
mm,
to neurological training in a number of countries. And then I finished my training there, and maybe I can just tell you how I got to where I am today, because I can take off from there. After I finished my training at PGI, I briefly returned to Kashmir. And, because of some reasons, then I moved to Saudi Arabia, and later I came to the US for neurology training. Because that's where after I went to Saudi Arabia, I realized that it's not a permanent place to be, but and I always uh, I thought if I have to go anywhere else other than Kashmir, then I would like to go to the US. And then I completed my neurology residency at Drexel University in Philadelphia, and then went on for further training to Duke University in North Carolina. And eventually I joined the University of Toledo. And at that point, they were in the process of building up a neurology department. I started the neurology residency, and I've been program director there for more than 25 years and eventually became vice chair. And currently I'm the chair of the department. So, while obviously this is a long journey and there were moments of uncertainty and transition, I can't say that everything was smooth sailing. But like I've said before, I didn't regard anything as insurmountable. And I have to say, I feel grateful for all the opportunities that I have received and for the journey that's gotten me to where I am now. So, that's what I can tell you about the challenges or the kind of milestones that of my career to the point where I am here.
Yeah, it's amazing, especially when you speak about like, you had like batchmates who were from, say, other than like Srinagar, or didn't know the language properly, but they still were so bright. I think somewhere we have realized, because we interact with a lot of youngsters, high school students, we have realized that, there's a lot of that sense of privilege, that they're not like humble, because I think they don't look, when we're young, we don't look out. We go to like nice schools and we don't actually look out for like other students who possibly don't have the same kind of resources like us. And I know that because I also see students here, but I have met like many students in like, back home. We try to mentor them and they have their sense of privilege. But I have learned this from you because we have interacted previously, but also from my boss here, that like being humble when you're in this, like, when you do so well in life and you've done, like, you've seen everything or like most of the things and you've been through so many experiences, you actually are so humble. And I'm like, how are you? Like, like, how is this even possible? And that kind of fascinates me about you, about Ramos, about Dr. Saab, Dr. Lal as well. So I'm kind of fascinated by that. And I think it's a very important quality to be that level-headed, be confident, but also be kind of level-headed at the same time. That you don't like, overestimate things, but you actually gauge what you're doing, but also you don't look down upon people who are less privileged than you. Kind of like
Absolutely.
holding everyone together, right?
Yeah,
Um,
absolutely. No, I'm sorry. I just want to say that we talk about a lot about humility and empathy in physicians. I think it is an important everyone. I don't think it should be just restricted to physicians. And certainly because I know this, I would like to send this message to the younger generation, particularly because they are the future after all. I think you said it in one word. Humility is very important. No matter how much you know, no matter how good you are, that is one quality that you must have, and that endears you to your people around you, and also makes you. Because if you're a mentor, then you need to model good qualities that your mentees can follow. And if you do not have those qualities as a mentor, I think that's a disadvantage.
No, no, absolutely. So the chair of the Department of Neurology, that to an endowed chair. I mean, it's an extraordinary achievement. When Dr. Saab told me, I was like, oh, I have to look this person up. Who is this? So tell us, what does leadership mean to you?
Well, that's kind of difficult question. It can be a very long answer. It can take, it can take different forms. And I don't want to be too long in my answer. I know you and I talked about, and I just want to put that in there, the attention span of the modern generation, including myself. I mean, it's not very long, honestly. It's probably not more than half an hour at the most. And truly, I include myself in that because of so many distractions nowadays. But I'm going to keep it brief. I mean, it's to me, leadership is of the department is to ability to articulate a clear vision for the department. Where are we going? What do we want? What do we want to do? And it's really simple in terms of being in medicine and being and neurology and being a chair of a neurology department. What is it that we want to do? We want to provide great care for our patients. Obviously,
Mm,
that's number one. We want to strive for excellence in education. We want to strive for excellence in research, and we want to provide excellent service. And,
mm,
so unless you have a vision, you don't know how you're going to go about it. So that is number one. And the question is, what can a leader do to go about that, to fulfill that vision? So you're dependent on people around you. So one of the things is to recruit and retain outstanding clinicians. who are not only neurologists but have subspecialty experience. There are
Mm,
many neurological diseases. There are diseases that cause dementia. There are diseases that cause affect muscles. And nowadays things are very specialized. So you must gather all kinds of people within your department. Uh, it's very important. And I think this is something, and I don't know how much of this exists in Kashmir, but it is certainly something to aim for. You must have invest in quality improvement initiatives, which would enhance patient safety and enhance
mm,
outcomes. How do we judge the quality of care that we provide? And that is an ongoing process. If we don't look back and see what we are doing wrong, I mean, we are missing something, and we are not able to provide the right solutions. And obviously, education, and research are a big part of what we do. So the other important thing is to surround yourself with people who are enthusiastic and committed educators, because we have a lot of residents and students
mm,
and fellows that need educating and mentoring. And I can't
mm,
do that on my own. Obviously, I need a lot of people to do that. And for them to be able to do that, you must ensure that you have a robust curriculum, that they provide instruction in, which is grounded in critical thinking. Those old days of anecdotal medicine are gone. Everything is evidence-based. And
yeah,
so we have to look at evidence when we are teaching. What are we teaching? I mean, is it true? Is it relevant? These are the things that we have to look at. And then nowadays, it's really important to encourage innovation in teaching, particularly technology enhanced education. We all talk about AI, et cetera, and
yeah,
I'm not going to go into that. I mean, that obviously there's a lot of things nowadays, but simple things like even a search engine. If you just now knowledge is at your fingertips. I mean, all you have to do is type something
yeah,
in Google, and you get like 3 pages of information, which in the days when I was studying, you had to go to the library, look up the index medicus. I don't even know if people know what that is, and then look at what journal, you needed, and then go to the shelves and search for that journal. Most of the time, someone had already taken it.
yeah,
So these are the, some of the things. And then, of course, it is very important to provide a good research environment. Any good department should not only be doing clinical medicine, should also be doing research, and both basic and clinical research. And it is important to support your faculty in that and provide infrastructure and help them get grant support and mentor them. So, these are some of the things. But most of all, what I want to say is that I don't really see myself just as an administrator. I also consider myself a mentor for my faculty and an advocate for my faculty, because I'm the link between my faculty and the dean and the institutional leadership. So I have to present their case, to the higher authorities. And finally, this is something we just talked about when you said about being humble. It is important for me to model that, to be humble and to have integrity and to be professional in my interactions. I can't expect my faculty to do that if I'm not like that myself.
no, absolutely, yeah.
So these are, some of the things to me now. Someone else may have a different definition of leadership, but these are some of what it means to me and what I have put into practice since I've become the chair of the department. I hope that was not too long-winded an answer. But,
No, it's really beautiful. So, I mean, of course, like, you set a great example for people who actually, like, they walk in your shoes later. So, yeah. But it comes, I want to highlight this point about this anecdotal, like, medicine. कश्मीर में ये अभी भी होता है कि अभी तुम्हें गर्मी हो गई है, तुम्हें सर्दी हो गई है, हर चीज में तबीयत ठीक नहीं है तो गर्मी हो गई है, ये कर लो, वो कर लो, दही खा लो, लाइक वो आई वुडंट से इट्स एनेक्डोटल मेडिसिन बट एटलीस्ट लाइक हमारा ऐसा ही होता है, या तो गर्मी है या तो सर्दी है. There's nothing else. But tell us now a little bit more about your interests in neurology. I know that you work with autoimmune disease, so if you can tell us briefly, so what are you working on? What is your
So,
specialty?
again, that's an interesting question, because I am, I have not given up my interest in all of neurology. So when I did my training at PGI, we did everything. We did adult neurology, pediatric neurology, everything
Wow,
beyond
yeah.
that. And so subspecialization was not the norm. In India, now that is no longer true, but during the time I did my training, you were everything, you were it in neurology. When I came to the United States, I, finished my fellowship at Duke in neuromuscular disease and particularly in myasthenia gravis, which is an autoimmune disease. But
Mhm.
especially, that still continues to be one of my major interests. But I soon realized that limiting myself to such a narrow field did not really
Mm.
align with my broader interests. And so I became a little restless. And so over time, I specialized in other specialties, particularly epilepsy and stroke and
Wow.
headache and
Yeah.
neurophysiology. So because I just wanted to, I just want to take care of everyone. Now, I will tell you that is becoming less, it is becoming more and more difficult and
Mm.
less common because everything is becoming specialized.
Yeah.
Myasthenia gravis, I gave you an example, is a neuromuscular disease. Now, you have neurology, then people go into neuromuscular disease, and then they go and specialize in one disease out of neuromuscular medicine. That is an advantage and a disadvantage. It's an
Mm.
advantage because you get very good treatment from a super specialist. That can be a disadvantage because sometimes the super specialist does not see the whole picture, does not see the broad picture. So this is an ongoing debate, even in the United States. Actually, currently, the neurology community is facing a shortage of general neurologists, people who can do everything, because there's
Yeah.
too much subspecialization going on. But it is what it is. I still think that specialization is going to become even more specialized as we go on with all this technology that is available. But one thing that no matter whatever I did, the one uh, uniform passion throughout my career, wherever I was, has been my passion for education. I was always interested in teaching. I remember even when I was at SMHS Hospital in Kashmir, I would gather all the students and I would love to teach them and let them know what I know. And this uh, led me to choose academic medicine and instead of private practice when I came to the United States. And I particularly value my time as a program director. I really enjoyed building up the program here at the University of Toledo because I had the opportunity to mentor and train the next generation of neurologists. And many of the people we trained have gone out and work in other institutions or have come back to serve as faculty in our own institution. And even nationally, I just very briefly, I was a director and a vice chair of the American Board of Psychiatry and Neurology, which is
Mm.
the national certifying organization. And I conducted many educational courses for the American Academy of Neurology and the American Clinical Neurophysiology Society, which are the biggest professional organizations in the US for neurology. I've been an examiner for the neurology board examinations. And again, I don't say this to kind of tell you how many great things I did, but it just shows that that really was my interest. And that is one part, interacting with students, interacting with fellows, interacting with residents, and like writing examination. I wrote examinations for the neurology, different neurology boards. I just loved that part. And I think that's been one of the most fulfilling aspects of what I've done so far. So, apart from my interest in neurologic diseases, I think in equally important and equally gratifying has been my interest in neurology education.
I mean, first of all, your achievements are examples for us, but they're actually inspirations for all of us, all the youngsters. So, like, it's a moment of a lot of pride for all of us that you've done so much, and yet you're still humble. That I don't know. That's like magical that I tell you. You talked about Kashmir as well, that you have had an opportunity, you've gone back, you teach at SMHS. With all the challenges we face, what do you think? Like, what is your opinion? How do we actually derive some progress with all the advancements? Like, we actually see the advances in medicine, um, or maybe like we talked about empathy. So, how do we kind of instill that? clinicians or healthcare professionals are going to be like empathetic towards patients? Because I understand that Kashmir is not that patient-centric, like we see America system here, right?
Right, absolutely. You know, one thing I do have to say, my wife and I visit Kashmir regularly, but I haven't lived there since 1988. So sometimes I think it would be unfair for me to tell Kashmiris what they should be doing because not being totally aware of the situation on the ground and, not having lived there for so long and knowing what hard times Kashmiris have gone through, and you do have to take that into account. In that sense, I admire the younger generation after being through so much, going through so much trauma, they're still doing so well. I'm not sure that progress and empathy are two separate things. I really think they should go hand in hand.
Yeah,
It's not either or. And as far as progress in actual progress in medicine in Kashmir, I don't think Kashmir is behind. When I've gone, there are 6 or 7 MRIs. There are many CAT scanners. Ultrasound is available. Are, excellent lab facilities available. Neuropathology, not just neuropathology. There are excellent pathologists. And it may not be on par with, the best of the West, but there is excellent care. It is a big change from when we were in training and when
mm,
we were, practicing medicine in Kashmir. So in terms of progress, I don't think that Kashmir is behind, and but
yeah,
it is uh, how good is this for the common person? Is that helping them?
yeah,
And are we doing enough for the common person, the people who are not able to pay for all these fancy private hospitals? I don't know that, honestly. And I'm not
yeah,
sure that we are doing that, to be honest. So, that's one thing, but I'm not sure that the onus there is only on the doctors. I guess that is on the government and the
yeah,
administration.
absolutely. Yeah,
The question of empathy and professionalism, this is to a large extent determined by the values of society and what is instilled into you as you're growing up. If you grow up with a set of values and then you're suddenly expected to be an angel when you become a doctor, I don't think that I don't think that's possible. But to be fair, I don't believe these, and I'm a firm believer in that. And people disagree with me here because we try and teach empathy and professionalism in medical schools in the U.S. I don't think you can teach it honestly. Maybe you can suggest it, but I don't think you can. It's not teachable. I think these are intrinsic qualities.
yeah,
I attended this talk where someone kind of said something really nice. He said, "We really learn professionalism in kindergarten, and don't be mean, be friendly, don't steal, don't do anything without asking permission." These are things you learn at a really young age, and if you don't learn them in kindergarten, you'll have difficulty learning them
yeah,
later. I mean, it's an exaggeration, but honestly, I think it is very true. So I'm not sure that these are teachable things. I think they're intrinsic qualities nurtured by society, and that's really important. But you can reinforce these qualities by having a good model. I keep going back to that. If you have a model who you see as kind of having integrity, having empathy, being professional in their dealings with patients. This is why I mentioned the models that I saw in Kashmir. The people that I mentioned, Dr. Lakman and Dr. Yusuf and Dr. Essen Gold and Dr. Rasnan, I mean, I cannot, uh, kind of praise them enough for how professional they were in their dealings, how empathetic they were with patients. And I learned from them, really. I learned a lot from them. And I think having a good model is important. But
yeah,
I'm not sure you can actually teach it like you teach neuroanatomy or, whatever, or a
yeah,
neurological disease. So that's my answer to that, really. I mean, this is a kind of, in some ways, an abstract thing. And, and it's something that you slowly build up over time. But in terms of progress, I don't really think that, yes, there are, really advanced things that may not be available, but compared to even 20 years ago, the kind of medical
yeah,
facilities in Kashmir, are not, really good. Whether facilities translate into good care, I don't know because I'm not there. So I can't really, comment on that.
No, I mean, I agree with all the like healthcare. I mean, I'm sorry, I know you work here. I have a bunch of like health conditions like migraine and stuff, but when I was in Switzerland doing my PhD, um, I think I had this persistent cough and it lasted for like 2.5 months. And then they tested for everything and they were like, oh, no, no, just take some painkillers. Oh, it will go away itself. So the day I landed, because my parents were bothered that I kept coughing all the time. So I landed in Kashmir. My dad directly took me to a doctor. And in 2 days, I was fine. So, and I was like, what? I hold Kashmiri or Indian doctors like in such high regard because whenever I'm sick and here people can't deal with it, like, I seriously like reach out to my doctors back home and like, you know what, you treat me because I don't know what they're doing here to me. But no, I mean, I agree somewhere because my family is there. So the progress, I mean, they've done a lot, but then maybe we have to work with this empathy angle, but also start very young with youngsters. Like, we are trying to do it at Kashmir Care Foundation as well, teach them kindness, empathy. Yeah,
Yeah, yes, that, you have to start young, really.
yeah,
And, you already said about people feeling privileged, and we have to take
yeah,
care of those qualities when people are younger, because otherwise they become ingrained and they're hard to shake off.
yeah. So we're almost concluding, but I would like to know a little bit more about like, your mentorship, that you mentored like so many students, residents, you spoke about that. And it's been like a central part of your professional career as well. So what is a message you would leave for, say, Kashmiri students or youngsters who are like pursuing science, medicine, or who are even dreaming to have a career abroad?
So, I don't want this to be a lecture, but in general, whether you're abroad or you're in Kashmir, there are a few important points when you're starting out your career. First of all, choose something that is of your interest and aligns with both your interests and your values. Because if you have a clear sense of purpose about what you want to do, it'll help you, sustain yourself through the challenges that you're definitely going to face some challenges and need to overcome them. The other thing is, and which is really important nowadays, even though learning has become easier, but I'm not sure everyone uses those things available. Always embrace learning and stay curious, because whatever field you're in, whether you're in medicine or science, basic neuroscience like you are, knowledge is always evolving, and the person should also evolve with it. So that's really important. And the one thing that I tell my residents always is don't be afraid to make mistakes. Do not be afraid to fail. You must learn. That's important. Don't make mistakes and not learn from them. You must learn from the mistakes. And that's, to me, that's always been the best way to learn. I've learned a lot from making mistakes. And so you have to respond with, I guess, reflection and resilience to a mistake,
Mhm,
not get depressed by it. It's actually a really good way of learning. And as we have discussed, your character is as important as your credentials, if not more important. And we've already discussed these qualities, and we won't belabor the point that being humble and having empathy and having integrity. These are all important things. So these are some general things across the board that anyone starting out on a career should be aware of. Now, if someone wants to, establish a career abroad, I mean, I can speak about the United States in particular because that's where I've spent all my time. I will tell you this continues to be the land of opportunity, no matter what anyone says. Hard work and sincerity and commitment are recognized here and rewarded. And it's not always easy, but merit matters. That's the great thing about the United States. Merit will get you anywhere, which is not true in the
mhm, yeah.
part of the world where we come from. So, that's my message. I would encourage you not to be discouraged by the political and social rhetoric that you hear from afar nowadays. The values of academic excellence and inclusion and diversity remain strong in the US, especially in the medical and scientific communities. And so this is really important. Don't be discouraged by what you hear in the news. These are
Mhm,
all temporary phases, they will go away. And the other thing that's also important is that building a meaningful career abroad doesn't mean that you should abandon your roots.
Yeah,
In fact, those of us who have been trained elsewhere and then come to the United States actually bring a unique perspective
yeah,
to the institutions where we are then working and teaching and serving patients. So it's important to know that you can be deeply committed to your adopted country, but you should always be proud of who you are, and
absolutely.
that's the most important message. Always be proud to be a Kashmiri and say you are, and don't forget the language, which is what a lot of us, me included, sometimes, particularly with our children, are
Mm.
not always good about.
Yeah, no, this is true. And I think we tried everything. I know we are speaking in English, but then if we start talking in Kashmiri, this will become like a 1 hour
No,
long.
no, I will. No, I will speak Mishkashur Pur Pahtaga, but the mushkil ki the difficult mushkil lafaz, it's difficult to do that and then be fluent and keep the
I know, that's what I meant.
I my wife and I at home speak in Kashmiri, so it's not that I don't know Kashmiri. But I thought in order to keep this moving and keep it short and sweet, hopefully that we should speak in English.
So, thank you so much, Dr. Saab. I mean, so much learning, like telling us about your journey, so many beautiful insights. You are definitely a beacon of like hope, resilience, and inspiration for so many who are going to watch this video as well. And also particularly for me, because I told you that, there's so many things I actually learned in our previous conversation and even today. You've actually shown us what is possible with hard work, perseverance, your resilience, and your confidence. And I think that is very important that, failures are only your milestones. You should just, move forward, move ahead, and don't be scared. There were so many things you also like, said while guiding youngsters, and not just Kashmiri youngsters, but anyone who's going to watch. Thank you so much for your time. Thank you for your insights and sharing so much wisdom that you have gained over the years during your experience in your career and this unwavering commitment that you actually have towards community and also this last part really like Ketana, it just completed the circle for us because then we're talking more about Kashmir and everything. And I want to say to everyone who's going to watch this beautiful conversation, the spotlight session, at Kashmir Care Foundation, we truly believe in the power of shared stories. So if you want us to interview someone or bring that conversation, just get back to us, write to us at info@kashmircarefoundation.org. We want to bring stories to you that are going to like inspire your dreams. And we want to talk about people and connections across borders. So stay tuned for more sessions, everyone. And until next time, like Dr. Saab said, curiosity is important. So stay curious, stay kind, and keep striving hard. Thank you and
Thank
Allah
you.
Hafiz.
Thank you very